joining us today. My name is Kendra Collins. I am the Community Relations Representative for Healthy You Clinics. I am joined here today by Dr. Alexander Dydyk, our Director of Pain Management, Weight Loss, and Wellness. Dr. Dydyk, introduce yourself, please.
Hi there, I'm Alex Dydyk. I'm glad I get a chance to talk to everyone. I'm a family medicine background. I did a residency in family medicine here in Phoenix, and then ended up doing 2 fellowships afterwards, one in sports medicine and another one in pain medicine. And then also did some board certification in obesity medicine, which is weight loss focus. So we try to have a holistic kind of approach to taking care of our patients, and happy to get to talk to you today.
So whether you're looking to shed those extra pounds gained over the holidays, adopt a more active lifestyle, or simply enhance your overall well-being, we've got you covered. Dr. Dydyk is here today with evidence-based approaches, practical advice, and motivational stories to inspire and empower you to your wellness journey.
A medically assisted weight loss program is a thing created here at Healthy You Clinics. And what we wanted to create was a way for patients to get great information about losing weight. Now, medically assisted weight loss may or may not include medications. It absolutely includes understanding how we lose weight, diet planning, understanding that we are all different. We all have our own health issues, and we all have different things that we like to eat. We all have different families and influences and things like that go into our life that directly relate to our weight and our health. Right? And so it's an individualized kind of program. Everyone's different. We all have to abide by the same kind of rules when it comes to losing weight. And we'll talk about it later, but a big part of it is a calorie deficit and just understanding how our body works fundamentally, so that we can expect that we're going to reach our goals.
Yeah.
Otherwise, I don't think anyone would want to be seen if they're not losing weight.
Right.
Yeah.
A lot of people in general expect to lose weight really fast.
Yeah.
What would you say your expectation is for patients to lose weight timeline-wise?
Timeline is all based off of how much weight someone wants to lose. You can lose as much weight as you want given enough time. Right? I think a lot of times what we see is someone sees someone on TV and say, I lost 25 pounds in a month. That's very unrealistic and very unhealthy in a lot of ways too. And generally speaking, most people are losing 1 or 2 pounds a week. And so you're looking at about 4 to 8 pounds per month for people. And so we kind of lay this out to begin with. Someone alone wants to lose 50 pounds, it might take them a year to do that. Just like it takes time for us to gain weight, it takes time for us to lose weight.
Right.
A lot of times I say it's just not as fun.
Right.
Losing weight is empowering, it's wonderful, but it's work, right? And so we have to kind of work through that and understand that the work we're putting in is actually seeing the results that we want.
Right. How does slow metabolism affect patients with wanting to lose weight?
There is a million reasons why we gain weight. You can have a slow metabolism. That could be just someone who's stationary, doesn't move that much. As we get older, we're not growing, right? So that's actually a big part of it as we get older. So there's a bunch of different reasons why we're gaining weight. Metabolism doesn't play a huge role when it comes to losing weight. We all kind of lose weight the exact same way. We have to have what's called a calorie deficit. So we come in underneath our calorie totals. We all need calories to walk, to talk, to do all of our normal activities. If we take in more than that, we're gaining weight. If we take in less than that, we are losing weight. And so when it comes to metabolism, we can kind of get a rough estimate of how many calories someone needs to maintain their weight. And then we can predict with a reasonable degree of certainty how many calories someone needs to be losing weight and losing weight consistently.
How do medications play a factor in a weight loss for patients?
Medications are a tool. So the tools are very useful for us, but we can't use them as a crutch, because medications do not make you lose weight. What they do is they suppress your appetite. And so appetite suppression is a huge role, because if you're not as hungry, you're not eating as much, people will lose weight in general. Unless someone's drinking, soda all day, every day, and then we're taking any calories from other sources. But in general, medication is used to make your life easier. Because as I mentioned, if we're trying to lose 50 pounds and it's going to take a year, this requires a lot of concerted effort. It's not necessarily about willpower, it's about kind of lifestyle change.
Right.
And if we incorporate medications into that, I think it's a very effective tool. When I have someone come see me and say, I want to be on this medication, but I'm not necessarily looking to make a lot of changes to my lifestyle and that, a lot of times I look at that as someone who may be a low responder, right? Because if we're not adopting and saying, hey, I have to be eating a certain amount of calories or a certain amount of food to expect losing weight,
right,
you might be only 8 pounds into your 50-pound kind of weight loss journey and then saying, hey, I'm not losing any more weight. Well, the opposite end of that spectrum is also true, where I have patients saying medication on average might make you lose 10 pounds, but they've lost 50 pounds on this medication. It's not the medication, it's because you're able to sustain the habits, maybe if we really need an additional boost to help us along that kind of weight loss journey. But even with all that said, I only have about 30% of my patients are on medication.
Oh, wow.
Most people are kind of doing it the old fashioned way.
Yeah.
Yeah.
What are some ways to combat hunger when trying to lose weight?
Hunger rules the day with a lot of people. So I think part of this is learning what it feels like to be hungry. I think that's something that we've really come in, really had to adopt over time if you're losing weight. Because we have to listen to our body and say, am I hungry or am I thirsty? Right? So this is something. If we're making sure we're staying hydrated, we make sure we're taking enough liquids in our diet, it's really important. A lot of times we reach for food when we actually don't really need to. If we're drinking enough water throughout the day, then that also could be helpful. One of the most important kind of factors is how much protein is in the diet. It doesn't necessarily have to be eating chicken breasts all day, but ultimately making sure we're supplementing enough protein with meals and snacks throughout the day that we are able to feel full longer. Proteins in general take longer to digest than things like carbohydrates, which are your breads, your grains, and things like that as well.
What are some small, tiny baby steps to take for patients wanting to start the weight loss journey? What are small actionable items that they can do?
My favorite thing for patients to think about is think of where you're at right now as your baseline. We're not gaining weight, we're not losing weight, we're just kind of right where we currently are in our weight loss journey. What we need to do is effectively find a way to reduce our calories, right? So there's only two ways that we do this. Either we're going to be eating less of exactly what we're eating, or we have to bulk up our calories enough of things that are healthy so that we're able to eat the same volume of food that we want. So one of the ways I always do this is we usually eat off of a 12-inch plate. We start eating off of a 6-inch plate. Smaller plate, we can't put as much food on. This is an effective way of making changes, right? There's a couple of rules that go with it. You can't go back for seconds, right? Because otherwise you kind of negated the first rule. And then we have the very conscientious, right? I have a lot of patients who say, I get bored at the end of the night. I want to eat something in the pantry. And so, one of those rules is after dinner, you go brush your teeth and you're not allowed to eat anything else the rest of the day. Now, these things are easier said than done, but in terms of you're saying, I'm trying to tap into the things that I can do to help, right? We shouldn't be drinking soda or juice or kind of whole milk and things that have lots of calories in them if we're trying to lose weight, because they don't really help us much in terms of nutrition, but definitely don't help us in terms of our calorie totals.
So how does our weight loss program here at Healthy You compare to others that are out there?
So I don't want to speak about anyone else's kind of weight loss program. However, in general, there's a lot of kind of push to kind of put people on medications, right? So I think part of that is, I think it's both patient driven as well as the way those practices are set up, right? We take care of all of our patients. We have kind of primary care, we do pain management, we have podiatry, we have interventional radiology. So it's kind of a holistic and really kind of integrated kind of care system. I think part of that is making sure it's always kind of patient focused. It's individualized in terms of what are your goals, what are your needs, and I think that that's something that can help us kind of both have excellent patient care and outcomes, but also kind of differentiate us with other people.
Yeah. Do you have anything else you want to add, Dr. Dydyk?
Yeah, I would say that one of the most important things when it comes to weight loss is it's hard, and I think we have a tendency to avoid things that are hard, but it's also very rewarding. I think everyone is up for the challenge. I think there has to be some level of kind of accepting how the body works. I can't change that because I'm not trying to be mean or tell people that they have to do something if they didn't know if it was going to help them, essentially. It doesn't mean that we don't face challenges and setbacks along the way. So we have to navigate a world where food is everywhere. We love food.
Oh yeah.
Food is communal. Food tastes good. Food is on every time we kind of open up our phones or turn on the TV. There's entire TV shows that are dedicated channels now that I watch all the time as well. Right. So we're constantly being bombarded with food, right? And so now when we're looking at weight loss, we're saying we have to adjust our current lifestyle, and we get very, very accustomed to the way we like things, right? We eat the things we want, we do the things that we want. And now if we're facing that when it comes to losing weight, we have to learn to make changes. And change is hard for everyone.
Absolutely, right.
Yeah.
Awesome. Well, thank you so much, Dr. Dydyk.
Thank you.
That wraps up our Q&A. Thank you so much, Dr. Dydyk, for joining us today. If anyone has any questions that were not answered today, please give us a call at 602-491-0703 or visit us on our website at www.healthyyouthclinics.com. Thank you so much, Dr. Dydyk.
Thank you.